So now we are discussing brief anatomy of platysma. Along with that, we go for platysma flap. So platysma is a thin quadrilateral muscle within the superficial cervical fascia of the neck. It is starting from the front of the neck and is extending towards the face. So it is a representation of the panniculus carnosus of the animals. It is a second arch muscle which is by means of the cervical branch of the facial nerve. So it is having various origins and insertions. Origin is from the skin and the deep cervical fascia in front of the upper part of the pectoralis major muscle and anterior part of the deltoid. And insertion, it is going up and forwards to reach the mandible, wherein the anterior fibers decussate and posterior fibers and intermediate fibers are attached to the lower part of the lower body of the mandible. As you could see, the lines that are there, they are the attachment. And at the angle of the mandible and at the masseter muscle, which is where it is located, a few of the posterior fibers, they go towards the angle of the mouth along with the rhizorius. Of course, rhizorius is supplied by other branch of the facial nerve, so not the cervical branch, and it helps in the movement of the opening and closing of the angle of the mouth. So when you take this understanding, so in the posterior triangle, it is present in the anterior inferior part, covering the anterior inferior part, and in the anterior triangle, it is present in the superior part of the neck, as you could see over here. So once you take the actions of the muscle are like above, it is acting vertically, it is creating ridges which helps in the venous return, and below it depresses the mandible as an opener of the mouth, as you could see. And when you take the applied aspects of this one, so suture the platysma separately so that it does not cause any harm to the underlying structures. Always go in the subplatysmal plane so that we will not damage any structures, and dissect the deep cervical fascia if venous bleeding is present to retract, and then so that the bleeding can be prevented. This is one applied aspect. Coming to the blood supply, so upper part is supplied by the submental branch of the facial artery, and lower part is supplied by the branch of transverse cervical artery. So this particular platysma can be used as a flap, as a myocutaneous apron flap, especially in the hyoid region and supraclavicular region. But because of the distinct disadvantages, most of the times it is not used for this head and neck reconstruction, because it is very thin and also it will get necrosed very easily as a part of flap necrosis. Thank you very much. And this is one important point, that is like a turkey gobbler's neck. So wherein the old people nowadays, they are being given the injections to decrease the wrinkles of the folds of the anterior part of the neck. This is one applied aspect that is being done nowadays. Thank you.